Case Study 3-1 Displaced fracture of the femoral neck. While walking home from the train station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. M.A. was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given a spinal anesthesia and positioned on an operating room table, with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip and abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case Study 3-2 Intertrochanteric fracture. A.R., age 88, slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. A.R. had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperatively, radiographs showed a non-displaced right intertrochanteric fracture. Intraoperatively, Mr. R. was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compression screw and side plate with screws. His postoperative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Case study questions. Number 1. Replacement of half of the joint component is internal fixation. Number 2. Substances that act against microorganisms is antibiotics. Number 3, in a position away from the midline of the body is abduction. Number 4, position toward the midline of the body is adduction. Number 5, the prefix is dis, meaning apart or away. Number 6, replacement, recovery, and rehabilitation. The prefix is re, and the meaning is back or behind. Number 7, avascular, the prefix is a, meaning non or not. Number 8, anesthesia and analgesic, the prefix is an, standing for without or not. Number 9, orthopedic, the prefix is ortho, meaning bone or straight. Number 10, externally, the prefix is ex, meaning out. Number 11, bipolar, the prefix is bi, meaning two or both. And number 12, unremarkable, the prefix is un, meaning not. Number 13, the adjective for the operating time span from decision for surgery to placement on the operating table is preoperative. Number 14, the adjective for the operative time span from placement on the operating room table until the transfer to post-anesthesia recovery unit or intensive care unit is intraoperative. And number 15, the adjective for the operative time span from admission to post-anesthesia is postoperative. Thank you.